Hello guys, welcome back to my YouTube channel. From this video, I will discuss about the relations of the pancreas. So it is easy when we divide the pancreas into several parts and discuss the relations. First, the head, then the neck region, then the body and the tail. We divided the pancreas into those regions and talk about the relations the structures related to those regions. So first we will see what are the relations of the head of the pancreas. When we talk about the head of the pancreas, you can see this is the pancreas. It is in the C-shaped concavity of the duodenum, and the blunt uncinate process arises from the lower part of the head. You can see here, and it turns to left behind the superior mesenteric vessels. These are the superior mesenteric vessels. So the uncinate process goes behind the superior mesenteric vessels. So anteriorly, the head is related from above downwards to the first part of the duodenum is there, and then the transverse colon is there, and the coils of the jejunum is there. But here the transverse colon and the small intestine has removed, so you cannot see them in this diagram. So remember, anteriorly the head is related from above downwards to the first part of the duodenum, transverse colon and the coils of jejunum. Next one is posterior relations of the head of the pancreas. So it is related to the common bile duct posteriorly. Here you can see the common bile duct here. This is the common bile duct and this is the pancreatic duct. Together it opens into the ampulla of Vater here, and you can see here is the portal vein, and here the superior mesenteric vein and superior mesenteric artery. This is the inferior vena cava. So let's see what are the posterior relations again. You can see common bile duct is in the posterior aspect of the head of the pancreas, and the other posterior relations of the head of the pancreas are, you can clearly see the inferior vena cava is a posterior relation, and the termination of the right and left renal veins are also posterior relations. The other relations of the head of the pancreas are above, below and right. Above, below, below and right. Here is the right. The head is enclosed in close relation with the duodenum, and the pancreatico-duodenal artery, which cannot be seen here, arterial arcades are also lie in the groove between the duodenum and the head of the pancreas. I will show you that in another picture. The uncinate process is related anteriorly. Here is the uncinate process, and it is related anteriorly to the superior mesenteric vessels, and posteriorly it is related to the abdominal aorta. This is the abdominal aorta. Here is the abdominal aorta. So uncinate process is related posteriorly to the abdominal aorta. Here you can see arterial arcades also. So you can see the celiac trunk here. This is the celiac trunk. So this is the left gastric artery originating from the celiac trunk. This is the common hepatic artery originating from the celiac trunk, and there is another artery. And here you can see the gastroduodenal artery. This is the gastroduodenal artery originate from the hepatic artery, or the common hepatic artery, and the gastroduodenal artery further divides into posterior superior pancreatico-duodenal artery here. This is the posterior superior pancreatico-duodenal artery, and then anterior superior pancreatico-duodenal artery. Here you can see the anterior superior pancreatico-duodenal artery. Those are the pancreatico-duodenal arterial arcades. So the pancreatico-duodenal arterial arcades lie in the groove between duodenum and the head of the pancreas. So these arterial arcades lies in between the groove in between the head of the pancreas and the duodenum. When we talk about the relations of the neck of the pancreas, anteriorly it is related in the upper part to the gastroduodenal artery, and the pylorus of the stomach, from which it's separated by lesser sac. Here in this diagram you can see the pylorus of the stomach. So you can see pylorus of the stomach is related to the related anteriorly to the neck of the pancreas, and it's the neck of the pancreas is separated from the pylorus of the stomach by lesser sac. In between these two structures there is lesser sac, which you cannot see here. You have to see a 3D view to look the lesser sac. Posterior relations are portal vein. The portal vein, this is the portal vein. It is a posterior relation to the neck of the pancreas. It is formed by the superior mesenteric vein and the splenic vein together, form the portal vein behind the neck of the pancreas. So it is an important relation, and remember that as well. Next, when we talk about the relations of the body of the pancreas, the body is triangular in cross section. Actually, there are three borders and three surfaces of the body. The anterior surface of the body of the pancreas lies in between anterior and superior borders, and the inferior surface lies in between anterior and inferior borders. That means like this. The cross section is like this. If this is the anterior border, this is the superior border, and this is the inferior border. Imagine this one is the anterior border, superior border and inferior border. So I mark the surfaces of the body of the pancreas in red color. This one is the anterior surface, and this one is the posterior surface, and this one is the inferior surface. Just imagine. I cannot show you the actual view here. Just imagine. So the anterior surface, this surface, anterior surface of the body of the pancreas is a part of a stomach bed. Remember that, stomach bed, and it is separated from posterior surface of the stomach by the lesser sac. That means omental bursa. The inferior surface of the body of the pancreas is in contact with the duodenojejunal flexure. Here is the duodenojejunal flexure. Here, this is the duodenojejunal flexure, and coils of the jejunum and left colic flexure is there. The posterior surface of the body of the pancreas is related from right to left. Let's see what are the relations of the posterior surface from right to left. Right side is here, from right to left here. So from right to left, there is abdominal aorta at the origin of the superior mesenteric artery. In this area, the origin of superior mesenteric artery, this is the superior mesenteric artery. Next, there is left crus of the diaphragm. There is left crus of the diaphragm actually here, left crus of the diaphragm. And then left renal vessels. Those are also cannot see. This is the kidney. So imagine the left renal vessel is in this area, going to the hilum of the kidney, left renal vessels. And then the left kidney, you can see left kidney and left suprarenal gland. Those are the posterior relations of the body of the pancreas from right to left. What are the relations? Abdominal aorta at the origin of the superior mesenteric artery. Then the left crus of the diaphragm, left renal vessels, left kidney and left suprarenal gland. When we talk about the tail of the pancreas here, this part, the tail of the pancreas here, this part, you can see posterior to the tail of the pancreas, there is left kidney, and you can see the splenic artery and the vein posterior to that, and you can see the tail of the pancreas in relation with the hilum of the spleen, and it goes towards the hilum of the spleen. So in the left side, the spleen is related to the tail of the pancreas, and anteriorly you can see the stomach is there. So it's anteriorly stomach, and actually the lesser sac is there. So that's all about the relations of the pancreas. Hope you guys clearly understood about the relations of the pancreas, as I divided the pancreas into several parts and talk about the relations. So thank you for watching.